Information Service Television Network samna ISTV na lepalitana sanduk sari bachayolgi akhna bahaksal gi thorum ni Hello Doctor hariba thorum sibu lepalitan meng tabiriba ISTV gi ikai khumna jariba nuluk jariba Shyamkishore Singh ngasi shomu kanna tangkak amagi wena sanduk jariba Hello Doctor gi thorum da taramna okchari Hello Doctor gi thamjari ba maru ba pandam di commit to be fit because your life matters miyo be khoi gi thawai punsi haibisi dagi hen tang ba malite marmaduna miyo be khoi si na de yektana haksang phana matau karmna leigedage haibisi Hello Doctor gi thamjari pandam duni hairiba wafam siga iroinana Hello Doctor na tungan ba Manipur gi saknai raba asuki matik ekoni kai khumjari ba experience leiraba health professional kayama kaujaba matamda pujel chauna lakpi yabi aduga ma guest doctor singdugi expertise punamaktu Manipur miyam gi specially ISTV gi pure singi damakta madugi health tips mayam du lepletan pibin lai ngasi Hello Doctor ge kone thamjari ba topic si hojik Manipur da yamna alarming web asuki matik kiningai web ba laina makal ni heart attack haidi ba topic si khanana bagi damak thamjari ngasi ki thamjari ba topic si gi expert foina hojik khoi gi studio da lengsin biri ba kai khumjari ba lamdam sigi yamna saknai raba doctor ni Dr. Shyamkishore doctor gi hojik library ba background kharadang ai panjage loinamak sunai kopsan jabadi nasa det but yam marwai ba kharadang jes kharadang ai lokhachage MD loisin birba matungda DM All India Institute of Medical Sciences dagi loisin bire sigi mathangda MRCP United Kingdom dagi FRCP London dagi loisin bire hena nungai jabadi Manipuri macha Dr. Singh leiriba Singh sigi lakta tomthin wena matang wena only Manipuri cardiologist who achieved the British Clinical Excellence Award hai batang ba award si medical profession da lebi basingna hek phangba ngamdaba awangba siga award sima phangbire hojik chief cardiologist and chairman Sky Hospital and Research Center Private Limited Impal West chief cardiologist wena hojik leibiri aduga khargi hena ine eton toming basi former consultant cardiologist King George Hospital London aduga American based Marquis Who's Who Millennium Edition eminent doctors of the world hairiba sigi platform sida Dr. Shyamkishore gi mingsi already yauraga lere include tawungam base yamna tang ba heka changba yadaba mafamni simasu changbi dana doctor na awang ba thaki masigi degree qualification mayam ga loinana tungan ba award area sing sida hek tanba yaba yam masangoi ba mayam si tanbirabani adana hari wafam si thamjarba matungda hojik ngasi Hello Doctor gi thorumda doctor bu taram noksari
thank you
doctor hojik koina su television screen da hojik kapthok charaga just pop up tawraga thamjari ni picture ama group photo ni sida doctor gi area se koina marking tawraga circle tawraga thami sigi area sima masigi experience simtang share to biro mona ngasi lengbi ko tanza logjar ga doctor da hajage
ani ahambada Manipur yauna India gi maham kaya da heart attack na naba aduga heart attack na sibai masingji hengalakpagi tanza seida aibu ISTV di studio da invite to birak ba aduga kai Manipur public singa interact tawbagi kudong jaba bibi damak sky aina sai Sky Hospital gi representative oina ISTV gi authority bu thagachari sigi picture si group photo si aingonda yamna unique oina unique oya du unique yamnu aina su yamna pamjana thamjabani aduga masi it was taken 25 years back. See, it was the turn of the century and the 21st century ki horokpa 2000 da European heart house da all the eminent cardiologists from all over the world were invited to formulate a strategy to treat heart attack. As an asiga topic siga sumari lena ba aduga ai na su yamna sigi 2000 sidagi di ai life has changed and I had been given the recognition as one of the eminent cardiologists of the world. Aduga adugi dagi di adum matang zar aigi career progression lakiba. Adani adugi picture
yamna rare collection ni and yamna passionate na tamuna man habibu tu su yamna ngaje. Ado hoji aina ngasigi thamjari topi hello doctor gi area swaida amuk aina just sanction jaragani ngasigi thamjari ba doctor topic se heart attack slightly kitang dipan bi di horoga ado heart attack se yaman manipur da su masi hogi besai kara kharagi mamang swaidagi heart attack ki wazi life si just heart attack number mu raga sakam dawa leiki daba punsi pikam na yam nungai tab thodu mayam su tai heart attack itself se what is heart attack all about? Karino, what heart attacks?
Heart attack results from the complete obstruction or occlusion of the blood flow to the heart muscles, and that is in short medical term da natabada common term da haitare aduga Manipuri da hairagadi heart is a muscular pump ne aduna si muscle sing sidida blood supply to riba coronary arteries ka wi si yamna chawbudine tu swana heart muscle ni sina duga swana coronary arteries masamsa sing si yamen chawbuna te 3 to 4 millimeter in lumen diameter aduna swana yomsul laga supply to dong tawi aduna si block to ro matamda muscle sing si heart ki muscle cells sing siba horai aduga suddenly stop tawrgadi suddenly the muscle cells died and that causes the symptoms and signs of heart attack. They the BP drop tawba they the collapse tarokpa they the cardiac arrest tarokpa ajuna madudadi am thuna action logdragadi chance of survival is very low.
So the complications se kharadi panbire adu kayam yamna serious oibno se adu kayam yam emergent oibno se aikoina masigi area si hek lakpa matamda heart attack na palakpa matamda magi severity se adu magi seriousness kadai da kayam yam realize the seriousness magi severity se kadai lege kamai toge haibudu su khara elaborate da habiramba yabran
yamna fajaba question ne aduga aruba su question ni haibidi si stage wise ni stage by stage da lakpani anuga God is kind haitare khoi heart attack si suddenly lakpa si di thoina sidi khara tangi aduna hana magi konoma pi khoi symptoms si hana lakhi
warning
signs hana lakhi hana warning si hana lakpa madam se da precaution logdana treatment of horagadi heart attack can be prevented. Adu ignore tawdana adu thoksa hogdabadagi heart attack tawasi masing yame aduna hana angina haidana thawak naba angina on exertion haidana kanada hoigi animation gi video da taw video gi mateng lawraga explain tawna khara nungai ni ahambadagi hobiragadi nungai jani ahambadagi hobirau sina normal heartbeat ni aduga mai artery supply in haije badwana yomdana laibani adana sina normal beating ni dagi sidagi sida easy blood flow ji fazana freely zelamini adagi di gradually heart attack tawgadabadu si hana early stage agi haurabani adana si atherosclerotic plaque haidana hojik sida yellow yellow color da napsalen horai si sigi sina luminant diameter si narrow oi ba hora bani mai khujin ba hora bani aduga si chatla kanda na chest pain oi ba aduga rest da chest pain oi da ba adagi sum sidegi stage sida yang hogdra di chest pain si at rest su lani ba aduda di unstable angina haidana lai adudagi henjelak sigi degi henjelak bada sigi plaque si atherosclerotic plaque si rupture tawri bajigi gi right lower side da red is kai is si rupture daw ko is plaque si rupture tawri adi thrombosis if fresh thrombus collection aggregation and the adhesiveness increases aduga over a very short period of time aduga sigi lumen je e jelly si completely blocked tor ko toine and see within minutes see sudden see my blood flow is blocked over the cell side the right side the young biraga the blood flow later ado the my machinjak later ado my blood flow later adana heart muscle cells suddenly hundreds and thousands of heart cell muscles started dying every second. But then within this period of time, very quickly we have to restore the blood flow. Aduna reperfusion therapy haidana therapy treatment gi matang lakpada
jamnungaji to jona jiji biosing simeng tabire with diagram ni aduna seeing is believing hoji aikoina usagriba video clip to the doctor and expert na phajana explain to wiri duni ana kramain to duna blood flow si block torpa si blockage si lakpagi and plaque si kamana rupture tawba habness chimpuna meng tabire aduna mioi begi heart ki importance aduna mioi begi hingba habsiga heart ka leneri bemari sida kariguma matamda sexual hogdabadagi yam khutong thiningai oiba pangkal amade yoksalagadi mioi begi punsi pikamnaba masi angakpunate therefore asigi khana nei nabasida ISTV Hello Doctor thro meng tabire ba biursi adumsu saruk yabiun haijage maramdi sanuk sari batorum si live phone in program ni adumna adum gi haksang da nungai taba maruina especially heart ki kari gi singna balai binaba adu betarabadi I can already television screen da idana thamliba Hello Doctor ki mobile number si sinabiu aduga isagi lefamdagi hariba number si kuthang da phone oina call to biragi sagi nungai taba kunim mukto hangnabagi madugi platform ma khoni pijabani tanja si love please take this opportunity and the mahan be don't miss it out and soidan wahang hangbiru saruk yabiu Hello Doctor ki thorom da dungi wahang akoni ngajeri yam nungaje doctor similar Manipur si saba thakpanara aduga hingiba punsi mahing lifestyle sinara kari no maram di khangjadre heart attack tawbagi masigi cases aduga si masing si yamna hengalakpa aduga yamna alarming oiba stage amada adumaina laibran khali the Manipur di yam thengdu biranguni sky hospital la ko admit torpa complaint me amsi boiba kayam common were Manipur heart attack areas
heart attack see unfortunately Manipur yauna India gi bhamam kayada heart attack ki changji hengale whereas in the western countries particularly UK da ga di heart attack ki changji 100 ai jaiba the last 20 years ana effort ama PUM di darkar lai honabam di darkar lai how to reduce the risk of heart attack how to reduce the incidence of heart attack sima at the time of during discussions preventive measures ki discussion matang dai hai jage and hojik in answer to your questions say the agi causes hypermakti high dragasu major risk factor haidana lady singji hengale haijariba for example agi diabetes mellitus uncontrolled aduga hypertension high blood pressure uncontrolled aduga these two are known as silent killers BP wanga ga su aduga blood sugar glucose akoina high rego blood glucose wanga ga su symptoms si leite symptoms si agi sleeping volcano dauna mai gi symptom dan lebi dauna banglang pokhaira kan di catastrophe thonba adumai tawba group ni anisi and anisi yamna important oi the routinely check up tawiraga si lerame haragadi concerned doctor da tanabiraga si under control thamagadi that will not cause, that will not reduce your survival. Adu heart attack su tholoi, adu heart stroke su tholoi, and the kidney yete causes the complication of this hypertension and diabetes will not occur. Aduma
Similarly, Adam, say example, midweek can call me. Ado I massage kasi to dopa tawag daw ni mase. Ado all of a sudden, adumana tawag si dagi itong gibde hawag train natraga kari gumam tawag dagi dum chowki de pam na tawag de hawag kan da gyan ta dre masi an heart attack oiramba mali oibiyai ado kaina heta hainaba ado heart attack sina naturally aduga madu very positively hek tawre haragadi misi ta heart bra misi sihen bra ado kamai to
sigi ai basi answer to ding da ai anim kano point anim ta hai joge jiki major risk factors sida major causes hai si ko da any important another two causes are there. One is smoking habit sima aduga number 3 number 4 da dyslipidemia haidana cholesterol makal manga leibisida koi gi mari di bad cholesterol na sima wangkhalak bagi se koi gi red meat sarakpa ka koi gi aduna lifestyle change tor pai tare aduma masi mari si lai aduga minor risk factor soi hajarake do hojiki again answering to your question, sudden death see there are many other causes also. One of the common causes is heart attack. Heart attack how that kills the person. Hai basi koi gi arrhythmic complication hai si complication thol ka doini arrhythmic complication hai dana heart attack to rakanda VF and ventricular fibrillation hai dana heart si am thuna koi heart si beating si effectively torokta ba the circulation comes to a standstill. Circulation lab karne da the patient collapse toga kobuga nangdangai within minutes da koi treatment bi hog daga dina jaga person duna I did not get time to call for help. My kobo I kanam tawre hai ba nangdana lagi daba yaubai aduma le aduga atopa complication amana pump failure haidana heart ki muscle sing di sijalapdagi heart ki pump si sondarapa dagi aduga vai aduna magi circulation si blood ta koi vital organs sing circulation si mamakta dana si bama. These are the two common causes of death in heart attack.
Na heart attack tawro matungda kariguma sibatar badi haiba koi doctor pibi marmani se masi soidina goigani haina area sima ana biosing tabire hojik panbibi matamdani magi risk factors mem haibira matam smoking ado yade ka harasu statutory warning mayam pirasu makhum duda irasu thakpudi adum thaknari lepte adagi red meat chabagi meat sidi koi meat itas ngatani Manipur da laibiriba himineriba Manipuri sing na chaba simusu yam maru oiba sigi area simusu panbiri ren area sing si amu khara chaung nung nei na bayan tanja du lakjage biar sing puning sing sinjari makata ba wang sing matang matang uji hangjage ada sigi asa kitang di panbiri warning sign and symptoms na tasing na re haibasi khudaki oiba natabda kitang mangjongna na kitang mamang sakhalakanda kari torok pa yai aikoina masi heart attack torok pa yai na haina khangjeba yaba adugumbagi sign and symptoms and haitare my warning sign and symptoms kari lebi
bada common symptoms si chest pain thabak na basi challakanda koi gi siri se dolan story mu ka bada haima ai thabak sikara chilli ne thabak janai aduga that subsided that would subside in around 5 minutes ni manga mudisang it doesn't suddenly subside to would the idea it takes around 5 to 10 minutes yam of the 10 minutes na 5 minutes gada the subside to me ali am khara muchat ba mong amakani adamai to ba stage the angina on exertion gawisi and that is the earliest sign earliest symptom rather symptom of having this atherosclerotic coronary artery disease. Adigi stage the action la ho ragadi madam amalera maneba whether it is due to uncontrolled diabetes, whether it was unknown before. Adi the check to ho ragadi adegi magi major risk factors
early detection naita
early detection ji laani adegi adai di mathang mathang an tawrani aduga ECG ma lokthok biba du yamna darkar lai aduga yamna kuibusu nate doesn't take long aduga deida heart attack to gore na te to diri na to do re haiba ma ai patient am last week te yengi Saturday dani aina yeng masida si ECG da talk te aduga worry sab to worry do the from the symptoms he was describing adu di I in my 35 years of experience aina high level sidi heart attack to do re sidi hospital da admission tawra gam thune yeng hodra gadi heart attack tawra ni hena hai bisi da khana ru gi ya haraga
sakre
thokene Saturday adi ai team na muk ndang da muk adai te blood test ka sula kan da remind muk tawi aduga MI heart attack ki ai blood test lai adu di negative oya that doesn't mean that he doesn't have symptom he doesn't that aduna experience also counts in this field this matter adai di Sunday da so muk aina remind akoina remind tawi adu Monday da report lagu lakpa da oina hajarage admission to gadra to roida habna haina to na ngainari ngai sida mana ngaina bhai ta akoina di am toin si
follow up didn't tawra
worrying oibani na aina su worrying oiba aina su khangabni na edi Monday da lai Monday da report lagu lakpa da symptom da dum laidi hi ai adu ni humni si na raga dum khang na lai bidong tawre morning sida da la report lagu lakpa ni ha de na sidi yar roi heart attack tawrani si admission tawra si heart attack tawra in the last 36 hours the kai dog what has happened today khangre aduga physics PNC has not gone aduga it is increasing the sidi admission to tawra si and tawra do admission tawra kan di heart attack tawgre in the previous 36 hours young view ba do di aduna the admission saman Monday da admission tawduna khotan tawre da hidang da kap da hidang da it took some time because it was more than 36 hours old symptom adu daidi coronary angiogram ga tawra stent ka hapaga ngasi di just satkre wa wa jeri ba adana aina ngasi round tawbuda oi haina ba khari yana chiko haina ina ko ko si di question of life and death ni haina ba khari yana chiko mathang de anadi
and compromise to wa ya ba area ya da bi area yamna emergent oiba emergency mathok tar ko matam da kasu tawroi dan leithok pasisu ignore tok pasisu yamna punsi se khudong thiningai we doctor takpiri se yam chungmunin khalle ado hoji habi ba matam da doctor maru wena magi symptoms maru hoji koina siria wangba ka ba step sing si stairs si ka khat padu azaida thabak ta na ba chilak pa kholap ka do bogi atopa other than that magi symptomatic kari kari ko ne khangje ba yaba kar live londa da kari kari tarup pa yai
pagi atopa symptom amana angina equivalent high hoigi chest pain one dinataba some other manifestation ko hoigi breathlessness soron waba particular stage in the soron warapa sum phamming de dik sok daba aduga si dollar ma thonam ka bada ai soron waine haraga de gi ngak la raga me equivalent to angina meni mari manga da mu phagiba and that's called angina equivalent adumasu adu kanto bitare aduga chest pain haibisi explain the buddha patient doctor explain the buddha koigi it needs some sort of IQ gara sang ba aduga high ba da phajana explain tawbangam da pasu yawi aduga aduna chinba thabak ta koi mi emna phamba dawna ga tawi ka haiba ka aduga adum lere aduga heart attack tor si da ai na yam important symptom ma ya jauge heart attack during the heart attack at the time of heart attack koi gi nausea and vomiting kasumara mere leitana
handong
throwing out koi handong ning pa handorak pa ai orak pa tar vomiting ko or aduga puk narak pa habisi refer pain from the heart aduga oramni na koi puki ko abdominal problem mandana koi seran ba na seram na ba line da treatment the one other the cell dongan ba adu nat ba heart ki maram da khang ba area na doctor na hospital da satana to ba da chalu ba su thena da na te adagi di sikari gino haibeda heart si ko heart ka abdomen ga si diaphragm na mai ko malai fibrotic membrane namle aduna separate obani sina stomach na silere diaphragm aduga heart na silere it's very close because lower inferior wall of the heart, if that is affected by the heart attack, the inflammation doctor mazi local temperature ga hengala kane aduna ji diaphragm si irritate over diaphragm si irritate over the makha ek lady stomach to irritate over adai di oning ba phawre ba adai di othore ba and this has got to be kept in mind because in the last 1 month I got one patient like that and sometime earlier adu atoba patient namasu adumai tawra lagi di adu si heart attack ki symptom oi ba yai haisma ai mayam da hajiningi aduga heart attack ki si heart tegi na ba anaba je pain je its heart is a very disciplined organ and hajiningi haibadi magi pain ji it will not go below umbilicus khoido gi makha da chalwe above umbilicus upper part of the abdomen that heart attack or pain from the heart can reach up to umbilicus
adu makha di nara aroi
di makha di heart nara ga heart attack na oiro heba adagi amana mathak ta kyam wan ka ya ge ba heart attack dagi na heart ki ji coronary artery disease dagi si koi gi jo gi lower jo box si ka ne ba heart attack na kokton si da oxyput si da pain ta holoi hajima ai ngon dagi lobi ronga si kenu si discussion si dagi it's not done it's not adagi left arm si pain lak pe ai may not be here thabak da na ta si da gad lak pe ai but sat pa da ba ji angina on exertion may not be necessarily typical chest pain but maybe at the along the left arm sima symptom of heart angina ne heart ki ischemic pain hai sini aduni aduga jiki sida koi gondroga si puk nare na ingon da patient ama thara ki puk nai hana hai sida heart attack ne na koi ingon da district ki thare adu nongai puk 12 muk tare midnight ne tangai biramo na koi khangna jana mai thu da lakpa ne du ga koi 24 hour service lai dum ngai re du district lakpani na yaur tare phana koi na ngai re 2 am ki dai di yore any yeng ma da from head to toe examination si tok dab dia di head to toe yeng ga matam da my pain si di yes it has come up to the upper part of the abdomen but the source of pain tore to the appendix rupture da me the lower right lower quadrant the pain the patient ma puk theng ba yadri khunna na na ha the pain or the puk khunna theng ba store ba manung lom da pain manung lom chale ba hat ki refer pain hai si
na ba ani su appendicitis sum tor ba appendix na ba khorpa to gusdi mathak ti dum theng budum yaro de na
yaro de ni adum lera de ki rupture to jagadi usually is confined in the right lower quadrant of the abdomen rupture to jagadi it spread all over the abdomen aduna thaba mathak han mathak ba idea sorry abdomen mathak ba yaro ba ya aduna ni adugi the patient do
medical professional singna khangba haibasina khara hena clinically khara kupsanna khangbudu adu natabada common people commoners kangu mayamna khangjaba yaba area swaidani hoji doctor na takpiri do adu naba makal sisu koina haibi wani ngasigi talk si marune hello doctor gi talk sida adum phanam su bior sing mafamda information mayam je doctor ni yam phajin pibiri aduna heart si attack torok matamda na basi upper abdomen gi part sing se masida narak pa yabagi chances se adum lei puk na na tukba haibidi consult to matamda line do discipline do tongan sakhi nungai to wari ga sutai adun masi yam sectioning ai oiba similar sina chawrak pa magi warning sign and symptoms to Charokpanate yam mapungona doctor na thambire adu tasing tasina confirmation haitare hoji ungdang daga lakpa dagi pung kuthra torki mamangda kharanganda taho haibada kitang madu moigi negligence kitang ngaineri ngeida attack to leramba sumbagi kudung jadaba kudung thium adu magi proper process of diagnosis haitare for confirmation heart attack se masidi kramai de hoji medical science ki advancement si technologically yam ayong na gre adu hoji masi diagnosis si kramai to
That's very vital. We must know how to diagnose. Everybody, every medical professional should know. And stage by stage, step by step. Karamba na if that is positive, yes, that is heart attack. Haibama. If that is positive, it is likely to be heart attack, and then that needs another support from another test. Haibam sulay. And ECG definitely, if ECG is abnormal, then you don't need anything. And in fact, is one of the earliest manifestation is the ECG. Chest pain ki matung da ECG lampu ne. The ECG ka dum iro ina na dum sana ramni har ga chest pain ai ka heart attack oira ga di. Duga ECG normal oi har ga heart ki laina nai te. The heart attack ta ora roi hai dia de. Positive oira ga di. Yes. Ngarang aina ngasi top kono ji tok ji ga habit rehearsal ma dog ga na sum khandana pung taru ka tar padai da ma 5:30 dai thoge dogan da emergency line da na dai dai na sigi kono maksini laptop simang nei na smai open da ga ai gi kono da staff da dum langsela me bai na talk is later but heart attack is now and now see heart attack ne na ai di da dai dai chenna ga yenge ba yengaga the ECG deja sidi heart attack oire na dum direct aina machine ki bari du thoga ire sidi heart attack oire yam thuna admission doroga adi yam thuna treatment horaga di the chance of survival goes up very high. In fact, the chance of survival of patients with heart attack treated at the dedicated heart attack center of Sky Hospital is higher than the global average. World ki average dagi Sky Hospital the yengba heart attack patient na henna survival rate si wange na handak the American Journal of Cardiology the phone rate.
Okay.
Look artificial intelligence na jo analyze the rate.
Yam nungai ba pawni ado picture ba Manipur
Asli de mayam the screen da si kan dog jari se share dog jari se aduga sinataba koi gi kana do sinataba koi gi kana do sisu kana sisu ni si yam tuna treatment ta hobadagi akoina angiogram tawraga yengbada magi kana si blood flow ji phajana chatan lerame phajana flow daw lerame aduga balloon angioplasty stent nung tenam da garitre adu di treatment gi kosu handare the patient ji mayum thuna chale. In other words, what I'm trying to emphasize is that yam thuna treatment gi diagnosis da hoba yam thuna treatment hoba and that helps improve survival. Hingobugi
siki doctor tapi matamda just pen later then comes to han bhek to gudu si ECG lobo se sidagi adu ECG da positive order bu heart attack to ridi haninga liti
to raga do ni magi saduna naina hajagi maina ahambagi sadde de yang patient do ECG da utraga su aingonda di phawre aduna
so the experience ki wa ma doctor
pan so here comes the importance of experience aduna ai na hen ware patient dai de patient ni dimsala khan na ni ha du rai ne ma no kedan tana dong dole kedan su tana ni ade dai di
life converge this machine do medical
professionals ai na khangam ni na it's a question of do dai ne sahi ju yamdri sahi another 40 years to live see ado ayam budi dwaina haina raga dum yana basu dum ayam ne budi yana yedu ga mani su ya da zakib su yawi du ado anyway that is different the patient in particular patients I'm happy now that ngasi hararo chakre and he will live another 30-40 years easily ana dai surum nu thap ka dia dre ko du ka
born again no open sima pi
mane
sima le do doctor hojik maroi na ko ta jab matam den som da eco tawgi angiogram tawgi TMT test kari kari no makal makal khare di taji adu mapung oi poti khangji drain adu ei bior sing bi hap tagini adu hojiki moi for confirmation to buda diagnosis tor matam ta sengna heart si masa sole nare natraga attack tor ko ye haibagi khangna na bi tungan tungan ba hiram mayam lai duini ba
ai matang matang ai jare
yes
adu jegi goi ECG tawre ka ECG tawsi da is the time to start treatment is the time to strike adu ga adu ECG sita ambiguous oiba hadi diagnostic oidaba aduga koi suspect ti tawraba heart attack to bagi ayana dudi aduga as a routine also as a part of the investigation for heart attack koi cardiac markers heart injury cardiac injury markers aidana troponin kind tabiramani troponin T lay I lay ko aduga they are more or less the same aduga adu tabodabu afaba machine na reliable oina pirak badaka lai aduna wrongly pisal lagadi adu is treatment wrong agoi diagnosis wrongly sir kidai ni andama yadre aduna adu hojiki troponin si adu cardiac markers sing si it takes some time adu maduna heart gi squeeze out oraga heart gi we kerani squeeze out of wise vibe ko heart gi tholaga blood laga the blood ge mu test oraga lagdoi na je aduna it may take some time. It may take usually say troponin agadi around 4 hours to sange. Ade the negative way. That doesn't mean that the patient has not had heart attack. At least the chest pain toraga within an hour another to the your anakpa hospital anakpa laibini. Akoi patient degi kaidina saguman adai diwa mane yamnakpa within minutes ta yaw kare within minutes yaw kare to ECG da heart attack lai re the blood test to the heart attack ki positive the oidri then start treatment this is heart attack and treatment ji haure aduga yam thuna hawani na magi di chance to survival do hadan lai re diba hidak si ka pa the hidak dak to kan da pungani hum 2 hours amki after about 2 hours da chalage boy galam yum hare ana koi ki adagi di test di blood test di troponin si di koi di am reliable American gi machine ni ana we have been using it for the last 10 years reliably ado negative oiraga su ECG the positive oiraga ni na start treatment all full treatment hand down na tabodagi di within about 2 hours da when no symptom for a chalage bo haram adagi di at that blood test result lagudu the positive oid and just leave it for now you repeat this after 4 hours and you see what it will be after 4 hours the hanbakanda the normal akoigi less than 40 or the insignificant the more than 40 or 40 nanogram per liter or the positive I think magi di after 4 hours the 2000 oil ml
okay as the
Mr. Umdoni ko
Mr. Umdoni
there is also again the experience counts hai sin eduna experience counts na te aduga younger generation also may learn and may know adu similarly and don't depend only on one. I have had 2 patients so far who died based only on troponin level. Troponin level is negative nena thado kiba hare effective oiba
CD
adagi sorry adagi eco dum da panjau eco si internationally di khagadi accept ore aduga ai su ko I have become, as I said, around the turn of the century in the last 25 years I'm known more in the West, in Europe and the US. Aduna eco si again akoi gi hospital the eco si am tuna dum as a part of the admission tawid eco si bedside ta matam da heart ki weakness to heart muscle ki weakness to dum urani it is also it's as good as like in the hands of God, in the good hands and the eco si na heart ki muscle wall si ECG duga chanana weak oiramagadi it again adds to the diagnosis of heart attack.
Similarly, TMT ki kaino musu tajeri sibu kayam yam maru oi
treadmill test TMT si heart attack tawgadaba duga pain at rest in the previous 24 hour adu the contraindication ni kaino da heart attack with TMT si echo di hipbaga tawbani rest tawbani TMT di patient ji chelaka doine the chill ade ma ya hana rest yamna hena khuda badu aduga is supply and demand ne bako hege heart ki muscle sing jina demand tar gadoini aduga hoigi coronary artery heart ki blood vessel sing jina blood se supply dog doini aduga hanana already narrow lairaba ga khujallaba artery duna di magi chelab ga matamda demand hengalai du piba ngamroi demand duna demand and supply dugi disparity mlane the patient can collapse and have heart attack. Now it occurs 1 in 10,000 dead Nico. TMT is not that innocent. It can cause problem if case selection da adana wasi di tobuya giroi hai maduna. I say again from this talk, from this the important talk, please just take home that TMT should not be done in any patient suspected of myocardial ischemia if the patient has had rest pain in the previous 24 hours. This is a contraindication.
Tadi tauning in su pangtok to we are ni megi health condition si yam na khambi bam change ba so the Dr. Singhi Marwina Cardiologist Singhi magi expertise experience so the depend to in haibado Dr. Shyamkishore Singh siba yam phajana ado Sky Hospital se Marwina hojik su mayamna recognition aduga award sing khotpa world gi wena sigi pithribi gi heart ki anaba laying basigi map ta Sky Hospital si yawe jam nungai ba pawdi oiba ado kari provided facilities under one roof kari no hojik piri chano technology gi Marwina infrastructure gi manpower gi knowledge gi karmai tori Sky
Hospital da hojik Sky Hospital la laidiba infrastructure si yam it is no less than any other infrastructures available in Washington, London or Delhi.
Okay.
I have a example on Nigeria. Eco sima makal gi laire bedside to boyaba and eco lab to boyaba laire and the transesophageal eco haidana sina eco hainer sina transthoracic sigi thabakta camera sinamaga tawoni sigi camera sina koi roughly di khang aya matam da usually diagnostic and posteriorly si heart si kutum mamuk chawi the mamangi sina phajana tai maningi si sometimes phajana ta da yaiba adu matam du di transesophageal echo haidana camera si transducer kawi si koi gi khudom bi simuk chawba ko finger si gi braid amuk chawba si diameter amuk chawba si koi gi endoscopy da endoscope to thinjal laga koi maning lom dagi from the back of the heart yengaga tawba yaba ngarang da su amatawi wa bhaijari ba ko aduga aduna hujik si adu UK da di yam common noi aduga government na su heart hospital ni ga hair ga di adu yog da ya di kaina mandatory oily aduma lai aduga da 3D echo ji hujik koina ma echo scenery wa yamba jaga sing scenery sing si 2D echo ko 2 dimensional hujik si 3 dimensional na koi swani yeng da maning da gi su uba down da wa daga koina the rotation ga tawraga maning gi side su uba adugi 3 dimensional mana adu akhoi gi da laiba kuire adu phajana adu dum scenery depending on the need. It's not that it has got to be done, it has got to be used for every patient. No, the selected patient that CD 2D in the taba ngamdre 3D dausi
samna harabada world class ki asukimatic advance whereba equipments me amsi Sky Hospital adum installation tawna putkin mingsi leire facilities leire
amtang ga panjawge intra-aortic balloon pump haidana yamna life saving ni si koi gi heart ki pump sida fail oira kanda inotropic drugs haidana makal makha mayam lere 560 usually available in most centers aduga 5-6 speed about the BBC kakhalakdaba means the heart pumping is not proper and not enough to supply blood to different vital organs of the body aduna hujik madugi matam da intra-aortic balloon pump si grow in degi taroga thingjallaga intra-aortic balloon pump si swai muk sangani ko about 40-50 centimeter ne aduga khar chawi swana inflate tawra kanda koi gi swana zawrani koi gi finger ki diameter swana zawr the my balloon ni ko sia amain taroga si sina support tawra kanda blood pressure ji wankala kane blood pressure wankala ga di aduna the heart ki kana si hujik BP ji ko ye kana da mean blood pressure high si ko when 60 mm mercury the thamna bonai adu 50 about that temporarily 50 about the su adum survive ko ye the chance of survival increases 60 or ga di madagi magi adequate way re ji malare aduna ko na augmented blood pressure ko wi hujik intra-aortic balloon pump ji sinaraga aduna adamana sinagi be da multi organ failure ai na si heart si failure aga di kidney failure pa liver failure pa si mayam si the lungs failure pa si mayam si koi ventilator no mayam ma digi dialysis hapani aduga dialysis koi on site lai aduga ICU da su lai adu si hapa ga hoji ki intra-aortic balloon pump sina main ora ka doin adagi amain taroga patient hingi basi akoi gi sky da yame aduga hoji all the multi organ failure haidanda heart fail oiraga aduga adagi septicemia and infection ji am serious oibadagi multi organ failure kana like bisi heart yauraga di septic shock and heart da down eda chali adugumada intra-aortic balloon pump ji sinaba koina sinaba sida world gi survival rate si around 50% ani koi sky da di 75%
okay
adu je koi publicity tawdri the is about to be published
sige simensi hojik doctor nga si platform se haibire ado Manipur miam especially ISTV gi Hello Doctor viewers sing sinamu loinamak si people sing si loina connect to hiduni sumani haibi be sige simensi yamna chobo mai papunen bana logjege am nungai ba pawni good news ne na similar
amta ga hajauge ade igmo wai na ma lei goi standard oi ba hojiki ventilator the intra-aortic balloon pump sina junga maktraba adu oragadi there is last option that is the IGMO extracorporeal membrane oxygenation machine hai na malai asima su koi sky hospital gi
similar treatment option da hoji haibu du di phanam di loi haibira bane yamba aswaida matam amad di open heart surgery gi kari gi tawe aswaida minimal access surgery adu tawrupa matam da sigi hoji gi balloon hapagi kari gi tawu khopase sigi technology du sinari ba magi application map se treatment option says the kitang swaida su highlight to birum khara treatment option si kari no aduna heart attack to ropagi best treatment option se
hujiki the available treatment options hujik kanle rekha ge thrombolytic therapy hai na clot bursting agent jo hai yam thuna kaphok ba
ifamjalak
pasi kandodana aduga loina na there are 3 more other drugs they are given together and then see the question of do or die na hingda ya desina na thazan ma dabne
means me am say at one time
da aduna see my dose it is dose specific for the weight of the patient, dose specific for the age of the patient, and then elderly 80 years old 85 years old frail 40-50 years old say weight 40 kilo ga weraga so those do barim thazaloga the bleeding torani complication in lani aduna taba aduna si thima similar si reperfusion therapy kawi sima adu yam thuna piba ngamagadi sina panapharani aduga yam thuna piba ngamagadi hoigi percutaneous coronary intervention haidana PCI haidana koigi balloon na coronary balloon angioplasty na balloon na jigi narrowing si the dilate or go and they give the stents hapaga
as I plaque torga picture to give
adugi duma balloon amta coronary angioplasty gi animation torgamta mayamga viewers inga share tawminasi sigi si normal flow ni adagidi obstruction lae laga sida sigi balloon togdorabni aduga sida hana guide wire aina yam here bread tagi kitang thaba koigi kanama metal gi kanama koigi
samna muk
jaw de kitang thaba na engine laga haino kan balloon du jalong engine madi yadamni na yam khun leiramni na na se adu
so insang
aduna si groin dagi chu chang ba yai aduga khut dagi radial artery de chu chang ba yai spine changaga si gi balloon si ai gi stent hap thing de balloon macha na hana khaga jum chok thon ba khagum chok thon laga balloon si hojigi phangi ba stent si balloon mounted stent hai balloon manung de yawi aduga balloon sina stent si expand ta holangani aduga mai gi atherosclerotic plaque si inthoga ngak dan thambiramba adu de blood si flow to matam da freely flow to
mai kap thokri
sina balloon hana khaga jaw thon mani kona choba stent yaw balloon ma jang kini si matung da guide wire de lehore adu guide wire si gi around se adu stent yaw balloon lai an stent si manung da balloon lai balloon sina inflate ta stent si subse laga pusalak pani adna si stent si jaw thome expand tor me thambira me adu idi sinang kana si plaque si ngak khok tana hoi ngak tan lai re
adu blood flow si nunga na frequency
normal like blood flow gel ni adu idi that's the end of it
yam nunga ji adu loslak patan ja si yore adu lying pathap si hojik si malem gi wina su hong bu myam lai manipur das why not hoji sky hospital gi treatment options myam pan bi dam doctor na habi adu matam sang na not less than 15 years mapanda UK da leibi dana London da leibi dana lying bagi sigi field says da physically yaur lakuni adu hoji manipur sibu ahong bu kayam leirege adu comparatively yam tena tang yeng biba matam da koi si more develop to mathau yam taribra adu already develop to re haidurira kari wali swaida sai disparity ga habibu treatment ki option ki kari lakoda kari kamal leri.
Yeah, thank you for asking that. In fact, I wanted to talk about it, but it didn't just slip from my mind. See, there are 16 districts. And out of 16 districts, there are only 2 districts, Imphal East and Imphal West, where there are cardiologists available. Aduga infrastructure the yaman hajar the government na the improve to na honarang gini and khali aduga but the fact is that cardiologists laitana infrastructure thamgani habidi thajaba khara diwale aduga cam lege habidi daudi aduga adugi based on that aduna aina government da koi Manipur Foundation ai presidency oi aduga Manipur Foundation ki through the gi government approach tabuni aduga koi gi telecardiology haidana gi district singsida peripheral district singsida koi gi cardiologist laitaba cardiology setup laitaba singsi ai koi Manipur Foundation koi contribute toge aduga telecardiology si lahensi haina tawdana tawdagi di government na yabi dana ko dagi 2021 da koi pilot project oina hogi adu install tawraga abdi ki last year da April ki da koi gandawra MOU du gandawra
sign tawna
no sign di han tawna gram 2021 da koi hana former CM Birens na gana to bidana gi inaugurate tawdana haurabani service aduga last year ki April da koi gono si MOU si renew togodaba da koina renewal gi application thagri aduga adugi reply di phangdri sahi mi henjale adana aigi mod haijab tagadi as a I'm the first medical cardiologist of the state of Manipur aduga aina prajagi hairagadi particularly those people who live in the district of Manipur where there is no cardiologist the telecardiologist am thuna mu restore dongnaba service restore toba ngamagadi kana over the phone ade hojikti adu machine puri install tawgre machine su install tawi aduga hojik atopa imaging su yam laibani na ECG share to bi ai tai share to bi ai aduga मदुगी एज पर एमओयू कोइन मंथली अमुक इको पुरगा इको मेजिंग पुरगा विजिट तौबगी अदुगी कनसु लई
यनु जे सिमा दु मणिपुर गी यामना जस्ट ओवरव्यू मा सिनारियो मा जरकम हैबी बने दु तसेंगना इंटरडिएट द लेबा द पेरिफेरी द लेबा अदु कनेक्टिविटी जे कितंग वाजब सिंगदु नारकनु दिया दे हारसे दुम नारकदुनी अदुई मतम दुदैदा माय वेस्ट एंड मीन्स थिरकप मतम दनी अदुना टेलीकार्डियोलॉजी सीगी एरिया का से हांगदुपिने तौरगदी टू सम एक्सटेंट कानबदु पिबुंगमगनी अदुना नाबई पुनसिउ कनबंगमगनी हैबिगे दोइदा venture tokduna admaina yam chawe initiative pum lobirambudu yam nungaji haitare lungasi yam isagi chinduni sai libi wari mem the hospital se emergency me am langda ma tokduni do hanagi leramba me am attend to khotpa punamuktu loina bak atang silent tokbiramaga ISTV putukse Hello Doctor ki thorum sida guest doctor woni lengsin biba ngasi ki thamjeriba topic heart attack hariba sida maruiba isagi leriba expertise sida ne ambar light tokbiragani aduna mamal yam labo apum kayam thambiramba sigi damakta doctor bu namkhilitna ISTV gi Hello Doctor gi team aduga whole staff ISTV makedi thakse phungdoksari
my pleasure
hariba apum si thamjabu loina ngasi gi matang sida Hello Doctor ki thorum mesinjare meng tabiru bipur sing aroi boina mukana kurumjari